I say your last name, Malek. All right. I'm going to say it a couple times, Leada, so I can make
Perfect.
sure I say Leada right. And your last name is Malek because I've
Oh,
screwed up people's
oh.
names and I probably won't again. But it's becoming an
The
ongoing
guest
joke.
literally said the name. We're like, it's Andres. And so he goes, my last name is Andres. And then he goes, introducing Justin Andreas. So he not only said it wrong, but like really slow to just show how much he was listening.
You're like the guy that's like, "Hi, I'm Nick," and they're like, "Hi, I'm so and so,"
good.
and you're like, 2 seconds later, I forgot their name.
But
It's okay. It happens.
hi, everyone, and welcome to Between Two Coaches. We're on a mission to make fitness more human. Snark sold separately. I'm Coach Amanda, and I'm joined as always by my co-host,
Coach Nick. Thanks everyone for joining us so much. We have a great episode today. Starting by introducing our amazing guest, it's Dr. Leada Malek. And
Nailed it.
Did I say it right?
Well done.
Hey! And we're going to have a great episode where we're going to answer some great questions.
She said, well done. He only had to say it 12 times before. Not difficult. But for Coach Nick, anything is possible.
Snaps for Nick.
Names are not my forte. But we have a great episode. We're going to answer a lot of questions around the physical therapy world and things around anything involving it, questions you guys have asked. So it's going to be awesome. But why don't we start, Leada? Why don't you introduce yourself for people who may not know who you are and, something about yourself.
Sounds
and
good.
We'll
Thanks,
go from there.
Coach Nick. My name is Leada. I'm a physical therapist based out of the Bay Area. I have in California. I'm located near San Francisco, if you're familiar with it. And I've been practicing for close to 9 years now. I have a doctor of physical therapy and certified strength and conditioning specialist. certs. I'm a board certified specialist in sports physical therapy, which is an advanced board specialty you have to sit for. I've recently written a book called The Science of Stretch. That's been out, but you'll find me in clinic part-time and part-time virtually, seeing people. I teach as adjunct faculty occasionally at the PT program nearby. My specialty population is typically high-level movers and athletes and everyone in between that's just starting or teens to elite, but generally someone who's trying to stay active through a period of their life or throughout life. And I just help them navigate different types of injuries and pains and surgeries and just keep them doing what they love so they can do that for as long as they want.
And if someone is not local to the Bay Area, are they able to work with you virtually?
Yeah, this is a good question. If you're in California, absolutely, and we can sort of bill insurance that way or write it off towards insurance. If you're outside of California, you'll see it as like an individual consult. We can't exactly treat because my license is in California, so I can't follow an injury and talk to other doctors and whatnot about that. But I can guide you into a direction.
That's great to know.
Yep.
That's great to know. Thank you very much. Well, you just listed, your credentials, your qualifications, and it is quite impressive, Dr. Leada, which is, of course, outside of you being a boss and an incredible human, you're really quite qualified to speak on all the questions that we got and some of the areas that I know that we spoke about offline that you love to explore, that really take into account the whole human going through, whether it's an injury, just wanting to get stronger, and supporting folks through their lifespan. And that's why we love you. So I think let's maybe start out with, you spoke a little bit about your specialties in sport. And I guess let's talk a little bit about before somebody gets injured, what would be the importance in working with someone like you and the importance of prehab for an active population?
I love talking about this because there's two ways you can view it, and there's, I think, an important caveat to include when you talk about it. Because one thing that we try not to do, because we really don't have the evidence to be like, look, if you don't do this, you will get this injury. There's a lot of maze, there's a lot of other types of factors involved. So with prehab, with the intention of prehab to prevent injury or at least reduce the risk of, it's more surrounding a basis of here's what we know about your sport. Here's what we know about athletes like you that have your similar training age, training experience, current like biological age, and what you're able to do and what your type of what you as an athlete and people like your case should do to reduce injury risk. But generally, prehab is talked about in a way to stay ahead of things that could go wrong. But with marketing that, there's also an important thing that you just have to word it correctly because you can't scare people into thinking that something's going to go wrong if they don't do it. So I always like to give that sort of thing. So we like to, with prehab in a positive sense, is just about staying on your game of what's needed so that you can keep doing what you like to do, given the factors we know that are modifiable in your situation or maybe your team situation so that we can reduce injury risk.
I think that that was, I didn't even think about how it's framed and how it could be unintentionally fear mongering or putting somebody in a state of like, oh my gosh, what do you mean when I get injured?
Right.
Or that's
small.
such a good point.
It's a small point, but I think it's worth, if it's going to help one person, just be like, oh, right, okay, so this is best case scenario, and understanding that there's, injuries can happen for no really good reason. There's so many things involved, unless you like falling off of tripping off a stair and spraining your ankle is one thing, but like running gradually and all of a sudden you're doing your usual plan and now something hurts is very different.
So another question our audience has had is rehab. Like when should people start working with you? When's the good idea of a plan, and when is the right time?
Definitely if something's been bothering you or causing you any fear or anxiety around your performance as whatever sport you're doing, if you feel like you definitely have an injury, all the basics, like if something is hurt, if you sprain your ankle, if you hurt your knee, if you fall, if you've seen a physician and they're like, go to PT, definitely come see us then. But in the grand scheme of things, I think people should know that they can see us even if something doesn't hurt. I like to, and that sort of leads us down that prehab road, because then you have all these potential questions, or you're like, hey, nothing really is bothering me right now, but I run this amount, this distance, this many times a week. I'm training for this in 3 months. Is there anything I should watch for, or what could I use to improve my program now? Here's what I'm doing. That's a great time to see a PT. So, and that could just be a one-off consult, gives you some direction, some things to keep in the back of your mind. For example, I had someone be like, hey, I'm running my first half marathon. I've never done this. I've actually never really run more than 3 minutes on a treadmill in my life. And this is what I'm doing. I'm like, okay, let's back it up and let's make sure you don't do too much too fast, the grand scheme of things. But are you strengthening? Are you not strength training? Because here's what you should do. If not, so all these little things. But definitely if you've had an injury or if you have any pain that you're unsure of how it typically behaves for your body, it may not even be pain. It might just be a symptom, maybe some tightness or an annoyance, an awareness. I like to say investigate that sooner than later. Address pain or symptoms as soon as possible. And that's when you can see a PT. If you have the means to do it, because those little things can linger and turn into other things or cause you to move a little differently. And if you move differently enough times, it might trigger something else. So that's kind of where I like to tell you. So if you have an injury, if you're unsure about something, or if you want to stay training to reach a certain goal, these are all ways to see a physical therapist.
I think that's great. I think runners, athletes, pain, usually it's like something hurts and they're like, okay, well, I'll just not run until it stops hurting, and all of a sudden it's 4 days later and they're like, oh well, now I need to run or exercise because it didn't get better, but still skipping that step of identifying what's happening. And then to your point, it's sometimes they don't stop because they're like, oh, I'm marathon training, or I'm in a big load period, so of course pain is going to happen, and then they stop having pain because your body's so well at using different muscles to do the same thing when it hurts. It's like, oh, I land on my foot this way, it hurts. So now I'll just not do that. And then the pain went away. And now we're good, right? Because that one pain went away. And next thing you know, down the road, they have a stress fracture or something worse because they've changed
Right.
their whole entire biomechanics because of the one injury that came up that they didn't want to see someone about.
Exactly.
I don't know if it's
Yeah.
fear, finances,
Yeah.
I don't know what it is always, but like for me, it's like usually if something pops up and it's not away by the next day, like I need to do something about it. Like it's not just, especially if it's happening
Right.
during exercise. If it's like, if it's happening every time exercising
Yeah.
and then it doesn't hurt the rest of the day, it's like, okay, well, this is clear. My
Right.
activity is causing this.
Mm-hmm.
Let's figure
The
out
other big
why.
issue, and I'm sure Lita will speak to this, is how there are certain sports that have normalized
Yeah.
that you should be in a state of pain.
Yes.
And because of that, people wait too long to, I think, some level of discomfort as some,
Right.
there are times. So my physical therapist, Lita, you know her, and Nick, you know her, is Dr. Vicky Seckley, who we've had on the podcast. And she is, I had an injury, for example, last year, a year and a half ago, a tendon injury. And sometimes it flares up when I increase mileage. And what I'm balancing now is managing the fear versus, okay, it's just, you're all right.
Yep.
You're safe. You're fine. But I do all of my exercises still to this day. And lo and behold, it gets better, within those 24 hours. And it's just the bot. It's nothing to be afraid of. And it's balancing that fear, which I know we'll talk about a little bit more later. But there's a difference between that and being in pain.
Right.
Something that is sharp. So I guess kind of leading into the next question, how do we know as an active population, whether that's runners or soccer players or what have you, because I know you also work with a lot of, and triathletes maybe. What are some common injuries you see in your practice, and how do people decipher, I guess, between discomfort, a little niggle, and something worth coming into you about?
I think the runners specifically, or anyone that has a high dose of running in whatever they do, those kinds of things will be tendon related, calf related, hip or knee. And if it's sort of muscular, which means it comes on with a muscle contraction, or when you use it and it's not necessarily near a bone, but it's somewhere in the middle between 2 points of a bone, that's going to be a little more muscular. And those kinds of things, that could be a little discomfort, a little soreness. That stuff might dissipate. I like to say, in a perfect world, 1 or 2 days, but sometimes even 4 days, if that goes away, because we know that soreness of potentially using a new muscle, that DOMS, can peak after 72 hours. So I always say, if it lasts more than 4 to 5 days, depending on the person, sometimes I will tell them a little earlier, because if they take 4 and 5, they might come 7 or 8. But that's one sign I'll say to potentially get it checked out. Some stuff I like to recommend getting on early, or anything that's neural or nervy or tingly or dull, somewhere deep. You can't really put your finger on it, and it's a tightness, but you can't seem to stretch it out. Those are all potentially nerve related, and those usually need a better plan than just keep running or keep trying to stretch it out. That kind of stuff can linger. Definitely, if you're feeling pain that's not going away after 4 to 5 days and it hurts every time you're doing an activity that requires impact, big red flag. I say go in, see someone. That could be tendon, that could be bone. We know stress fractures are common in my running population too. But something like cycling, even things that hurt with sustained positions. For example, for the cyclist, sometimes you'll get a little ulnar nerve stuff just from having their wrists and elbows bent and leaning onto that area. Neck pain with sustained positioning for the triathletes or the long-term cyclists. That kind of stuff requires some offsetting of all the volume they're doing in that position to help take some symptoms down or give the body a different stimulus, whether it's working on some upper back mobility or maybe some stability at the neck, just firing up different areas so you offload. Or if it takes cutting down miles or time in a certain position, then that's what it takes. Or switching the hand position or positions on the bike. So those are some just examples.
Yeah, I saw you had a great video about hamstring,
Yeah.
and nerve related stuff, and like doing active like flossing or nerve gliding or whatever the technical term, but like so that kind of, and like doing
Yeah.
little movements to sort of help it out as opposed to just sitting there stagnant,
Yeah.
letting it rest because we're like pain, just don't do anything. Like sometimes we need active things, and that's what physical therapists can help. Once you get, and again, it's like sometimes people don't understand that going to a physical therapist or a registered dietitian, like sometimes that learning knowledge too, like you're not going to diagnose yourself, but like you come walk away with some knowledge that you don't have, that's hard to decipher in today's internet because there's so much garbage and you don't know what. So you walk away with an expert, you get something helpful for you, and then you sort of can do that on your own when it comes up. And then if you can't, if it's sort of not solving itself after your little steps, then it's like, okay, well, I'll go back to the expert I have, right? And so take that. And like Achilles tendonitis is something I think runners ignore way too often until it's like debilitating, and then they're like out for weeks, and it's like the most awful thing because every step hurts. Your life hurts walking around, and it's so slow to come back because you've destroyed this thing when it's starting to hurt, right? It's not like all of a sudden you go from 0 to 100. You've done this over months, but you've kind of been like, it's okay, pain just a little bit, a little bit more. Okay, now it's debilitating.
You just, speaking of garbage, I did want to just, Dr. Leada's content on Instagram it's iconic.
Oh my God.
The way that you've been able to navigate not sounding like an Instagram typical physical therapist. Fix your IT band syndrome in 3 easy exercises. The way that you can provide the it depends, the it nuance, we are not worthy.
Oh my God, thank you. That is something I've worked so hard on.
Yeah, I'm the homie who reads those captions and I'm like, she just gave a dissertation. I hope y'all appreciate this. So blessings be upon you.
Thank you so much.
And it's so good too, like because like it's hard to give that kind of not nuance but information in Instagram, right? Like you have a short attendance display in 8 seconds, like to get this thing across and get someone to even read your caption or even stop. And so like you want to give information out. You don't want to fall for the tricks that will work because they're misleading and terrible, but that might get someone to look at your post and then get information out. But like you do a great job of like not doing that, but still getting people to view and watch. So
it's edutainment.
Oh my God, that is such a compliment.
Edutainment.
Did we just?
I think you
did. We just invent
I'm not sure, but put a trademark on a bitch.
Thank you so much. Yeah, that is. I mean, part of that was my own. Just I did not want to come across like that's just trash. First of all, that is garbage. Let's just fix this or whatever. But also getting the right people to find me are also people that are willing to learn too. So I think that's really helped foster like a positive community experience, because otherwise you're going to get people that are like, well, you said 3 things would fix it and it's not fixed yet. And I'm like, yeah, it's kind of rough, isn't it? It's because it doesn't work like that. But I really appreciate it. Gosh. What were we talking about? Oh, with the addressing pain early with the runners, I do want to say that having like 2 to 3 weeks with a modified load, I think people always forget that like that's a lot better mentally, physically, emotionally than 6 to 8 months off entirely. And I think that's the risk you take when you ignore something. For example, a little heel pain or hip pain that might actually be an underlying stress fracture, which stress fractures are a pain in the ass. Like they don't heal that quickly. They take their time. There's a lot of things that go into what makes bone heal, what reconditions muscles and tendons that were probably already weak to start with. You have so much more on your plate if you just brush it off like it's nothing. And then you have a lot of undoing to do after the fact, because now 6 months later, you've been like mentally in the zone of not being able to do your favorite thing. So just the cost is so high, which is why I try to tell people like, hey, get it assessed right away. And getting it assessed may not mean that you need 6 months of PT. Maybe it's one visit that tells you how to switch up 2 things for 3 weeks or 2 weeks, and now you're good. Boom, like so much better. And I think just saves people the headache. So getting assessed, as I say, address pain, address uncertainty ASAP, get a plan, so that you can keep doing your thing, because nothing's worse than not being able to do what you love for too long, which is for runners like a day.
Yeah. No, that's a great point. Maybe I think that should lead to our next kind of topic
Yeah.
about like the mental aspect of injury. And you sort of touched on it a little bit. I think what runners and all athletes don't understand is sometimes
Yeah.
they want to work through the pain and they're like, oh, what's the worst? I have heard this. What's the worst that happens? I get a stress fracture. It'll heal in
Right.
6 to 8 weeks and I'll be back at it. And maybe it does, and that's fine. Bones are sometimes sturdy and they have an ability to do that. They don't always. But there's this mental side that they're ignoring. And, we've talked about it in other episodes, Amanda, like, with Dr. Stephanie, but like about like people whose obsession and compulsion of it like drives them to take their stress fracture, wrap it in a saran wrap or plastic bag and go in the pool and do their aqua jogging in their cast because they can't be without this thing that they caused themselves to lose. And there's so maybe before I answer the question I'm asking, but maybe
we
you
were
could
just
talk
talking
a
about one
little
of
bit
our
more
biggest
about
pet peeves
the
on podcasts, Leada, and one of them is when somebody asks you the question as the guest, like, what are some mental aspects that are most prevalent in your clients? And I think, Dr. Lee, and you're like, sis, you just asked me the question and now you're answering the question. Take several seats. Okay, go ahead. Nicholas,
That's
do I
so
need to find a
funny.
new co-host?
I was leading
So
into it, and then I went
what was
too
the
far.
question? It
But I
was
stopped, but I
mental
caught myself, and I
aspects
said,
of-
Yeah, see what happens? Do you see what happens? She doesn't even know who she is anymore. She's like, what's my name?
where am I?
Ask.
All right, we'll re-ask. Well, maybe you could talk. So we were leading to it, but maybe you could talk a little bit of the mental aspect of injury and like how you help athletes work through it.
So there's a few things that we definitely want to watch for when it comes to the athlete who is undergoing an injury recovery program or just dealing with something. There's a fine line between picking up and screening for things that I can help navigate through with the patient or the athlete, and also recognizing when it's time to refer out and it's beyond me. So there are certain things that I would refer to sports psych for, or some a mental health care professional. But some of the things I see, which there are normal responses to injury and there are abnormal responses to injury. And some of the normal stuff is feeling bummed that you can't do something, or maybe you lose interest in a couple. It's like it's normal to feel some of those things. It really is. But the issue lies in when it affects the rest of your life too much and affects your ability to take care of yourself physically, mentally, emotionally. And sometimes that accompanies those normal feelings that stay too long. So you're looking at like over potentially 8 weeks or even longer, where it's now starting to eat away at your mental health. Athletes, we talk about this thing called athlete identity. And that's how someone associates themselves with their sports. Like, I'm an athlete, I'm a runner, this is my purpose, this is what I do, this is what I'm good at, and this is basically what I revolve my life around. Those athletes, people with a stronger athlete identity, are at a greater risk for things like depression and anxiety in the presence of injury. So, as a preemptive thing, always good to remind people that they are more than their sport, they are more than just being an athlete in what they do, encouraging them to try other modes of movement if that's allowed with their competition, finding things to fill their cup in that are not physical. Sometimes you could say that aren't your sport, but I like to also emphasize that are not physical or related to exercise, because sometimes those athletes that lose the ability to run or whatever it is, will turn to other modes of exercise, which are still sort of not helping their recovery. And then you're dealing with other factors, food, nutrition, emotional eating, emotional restricting, these kinds of things that are just playing a role in how they come back. So some of those things that I'm watching, and I'm asking a lot of questions in PT just over the course. The first time I see someone, I'm asking about their relationship with food and exercise, just very briefly, just not digging in too much, but I get an idea pretty quickly about where things are at, how important their sport is to them, how important their ability to train is to them. If they're like, it's everything, if I don't do this, and people will actually tell me that, like, if I can't do this, my mental health is at risk. I'm like, okay, well, there are other things that we need to talk about and unpack a bit. But when someone is really tied up with their sport, it's important to understand the pieces that contribute to that, because when and if injuries happen, navigating that process, understanding all the things that matter and all the things we can do to help keep people's mental health in order during this recovery is really huge, because that is the last thing you want on top of everything, is just like another injury essentially that you have to take care of.
We see a lot of
Yeah.
running. Sorry, Nick.
No, go ahead.
We
Amanda.
see a lot of running accounts, whether that's influencers or content creators, getting injured and either treating it themselves, or I'm not sure what they're doing, but I like to refer to it as the chaotic cross-training sandwich, where they can't do their long run on Saturday
Oh my God, yeah.
because they found out that they had a stress reaction, and instead of taking the time off, next thing you know, it's a 2-hour Peloton ride and aqua jogging.
Yep.
Make it make sense. But it does make sense when your relationship to yourself is so deeply tied in if you move or not. Yeah. So I love that you, as a professional who is, you recognize your scope of practice, but you need to ask these questions when you're assessing someone. It's critical.
Yeah. And we talk about all day about how there's,
I think the whole team.
It's just like we talk about all day. These physical therapists will say, like, there's so many factors involved with your rehab, and then if they're not touching on those factors, or at least have a sense of how to screen for them and refer out, what good does it do to bring them up? I'm like, you talk about how sleep is important, how nutrition is important, but you can't direct the person to the right resource or screen for when these things are. So that's why I think it's so important to me in my practice, is that if my plan isn't working and I'm missing a huge piece to it, I haven't even asked about nutrition, that's not a really solid understanding about all the factors that affect rehab. That's just one piece.
Yeah. And I was going to say, like, the whole team is responsible for the athlete, right? And so, like, I love that as a PT, you're asking while they're in your care, right? Because a lot of times what happens with my athletes is when they get an injury, we pause training. You know, I don't want them billing if I can't provide them something, so we take a little break. But I tell them I'm still their coach, right? So like I'm not gone. I'm just don't want you to pay for a plan that I can't give you. But so then we hand them over to usually their PT, and I love when I hear from their PTs that they're sort of talking to them and asking them questions and, like, you know, involved in making sure that they're not, you know, having a negative reaction to the injury, right? And so I always reach out pretty often with my athletes every couple of weeks just to check in and how are you doing with the injury? How are you doing with not running? Like, what's going on? And just like as my also check in to make sure they're okay and that they're working through the injury and they're not, like, you know, beating themselves up or like thinking they lost all their fitness or all their goals or, like, you know, all those things that come, the catastrophic mind, you know, messing up your way of thinking, like when things are going great and all of a sudden it's not, why me, it's always me, like, and it's like, you know, the whole team is responsible sort of to ask those questions. None of us are psychologists, but we're all, you know, taking care of a human being who has complex feelings and thoughts. And so I love to hear when PTs do that. I love to hear when nutritionists are also checking in more than just, okay, well, you're not eating, but why? Like, what's going on in your life? Like, asking those questions and understanding the human being, because it can be easy to just be a virtual person and just be clinical. Or, you know, in my case, you know, just look at the running plan, look at the numbers, say your numbers are good, and not understand that there's other things going on. And maybe this person is obsessing about running too much, wants too many miles, overdoing it, and they're about to implode because of things in their life. Like, I need to be able to support that back and see that before all of a sudden I run them into the ground, not knowing, you know, they're going through a breakup or traumatic stuff in their life and that kind of stuff. So I love hearing that all providers, all people on the team are supporting.
I think there was a study. I know there was a study, but I'm going to misquote it, but I'm sure Leada has seen it,
Mhm.
where research shows actually that if you believe you will get better, and that includes having people in your corner,
Mhm.
like Leada, if you believe you will get better, and if you believe your injury will heal, the rate in which your injury will heal is faster than someone who gets stuck in that negative self-talk loop.
Yeah, those positive beliefs.
Not without doing anything, of course,
Right,
but
right. Positive, that positive mindset, and it's like so easy to just say like stay positive, but like actually trying to holster like all those feelings and funnel them into, okay, this is going to work out. I know I can do this. I know this is hard right now, but being positive about your outcomes and having those positive beliefs. We've seen it a lot with back pain, because there's so much research on back pain, but it does impact outcomes. It's going to make people feel more confident. It's going to improve their self efficacy. It's going to get them to show up. It's going to get them to do their stuff better, and show up for their PT, for their coach. All these things are so important. So when you veer from that and you just spiral, on purpose or not on purpose, it could happen unintentionally. Like, it's hard. Injuries are hard, but being able to stay with your head above water is really important for the long term. And it just sucks when things get really hard, and I know they do. Injuries are usually, no one like wants to be injured. No one's like, yay, get to go to PT and take down my mileage. But when you are able to get that plan and feel like you have a direction to go in, and feel good about that outcome that is within reach, or will be within reach soon, makes such a big difference.
Yeah, having the plan is huge. I think it really helps athletes get back and see the way forward. But also just like understanding for all athletes, like injuries happen. Like anytime you're
Mm-hmm.
chasing your potential,
Yep.
like there is a risk. Like no one. There's many studies that show over the course of time, you're almost guaranteed that
Mm-hmm.
you will get an injury over a certain amount of years. Like it's just going to happen, and it's just how will
Yeah.
you handle it, because it will always come at the
Mm-hmm.
worst time. I'm the best fitness of my life. Oh my god! And no injury now.
Yep.
Everything's ruined. I'll never get back to this point again. It's like you will. Just
Yep.
work through it.
the setback is a setup, my
Oh,
friends.
I
The
like
setback
it.
is a setup.
Love that.
Yes, it's something I had to repeatedly tell myself in my injury.
Yeah.
And it is, I lived through it, and I didn't notice it at the time, but as I'm sure many of you listening who have experienced injury can attest to, you learn lessons, you become better equipped to handle other tough moments, and you do your physical therapy exercises until you die. Okay? You do it until you die. And that's what I'm here to tell everyone. Just like when people ask me, is there a time in my life where I'm not going to strength train? I say no.
Probably not.
I say no, Luis. Luis, you will do single leg deadlifts until you die. I have no other news for you. So you touched a little bit on it before, but I'm curious. And again, like we recognize your scope of practice,
Yeah.
but you highlighted the importance of fueling and nutrition in the healing process. Talk to us a little bit about what we know about soft tissue healing, bone healing when it comes to nutrition.
So there's a whole scope of what dietitians can talk to you about, things that facilitate that anti-inflammation and bone remodeling, your vitamins, your vitamin D, calcium, all that's important, protein for muscle building. This all is true. Now, the thing is, when you come in for an injury and say you have a stress fracture and potentially your diet or nutrition intake contributed to this stress fracture, or not, even if you show up to PT and you're not fueled, look, I have a certain stimulus that I need to be able to coordinate for your body so that it can build on itself and remodel. And when you don't have the energy to sustain said stimulus, things don't get that healing potential that they would otherwise have. And they may not heal as quickly as they should. Intake is huge. And that's, I always talk about like energy availability and low energy intake and all that stuff. But being able to take in enough so that you have energy and nutrients to support the activity, even if it's not running or swimming or cycling or whatever it is huge, because PT is not easy, and we have injured tissues that we're trying to facilitate a healing process at, with often load, with pain management, all this stuff plays a role. So if you're not meeting those needs, I can't guarantee that you're going to be getting better in the timeline that we're both aiming for. And there's a good chance that things might take longer, and you also probably won't feel as good if you are energized and fueled properly. So that's kind of my basis is, if you want this to work, you need to eat appropriately. And if you want to keep doing what you want to do, running, whatever it is, you also need to make sure that it stays at this line, if not better, when you are doing it. Because nutrition is, if without nutrition and without proper sleep, like our efforts are pretty jack. Like it's our body, the way we age, the way the body's natural processes are, if we're not meeting the basics, something's going to give. And it's typically something like we can see like it or feel like an injury, or it's something internally that we can't see right away, which is often what happens with stress fractures or like loss of someone's period or other things like that play a huge role in it. So above all, fuel is a major piece to meeting your goals.
Fed is best.
I feel like that is best. I was gonna say, I feel like most people when they get injured sort of
Exactly.
drop nutrition, right? Like it's easy
You
when
still
they're
need to eat even though you're injured.
to like keep it up. Oh, I'm draining. I'm doing all this work. Yeah, and so like and then like it's as us, provide coaches and physical therapists and others and nutritionists are like, hey, are you getting enough sleep? Are you eating enough? And athletes, that's probably why you're not healing. They don't heal that right. Like they're not healing because they're not doing enough work. They're not training hard enough. They're not doing enough PT. They're not doing. I feel like everyone would be better equipped if they had one of those bars.
Yeah,
that you have in the Sims, like,
I think about that all the time.
And then like you could be like, see, this is why you're hurt.
I think about that all the time.
Like it's really low. This is why you're
I'm
hurt.
like, wow, my bar is in negatives. I'm tired. Like I've thought about that recently. It's so funny. It would be a lot easier to visualize.
And oftentimes your body actually, what somebody believes eating enough is, and unless they are working with a sports nutrition professional, is likely low.
Yep.
A lot of people are under fueling, and it hasn't reached the point where something has gone wrong enough.
Yeah.
And or they've normalized how they feel. So they think like, oh, this is just who I am. I'm just fatigued. It just takes me several days to recover from a run. It's normal for me to need a nap after a long run. Like, no, it's not. And your body requires more resources when you're injured to heal that area. So we got to eat, not just eat enough. We may have to eat more.
Exactly. Mental energy, physical energy, that all eats away at what you're taking in. So just because you're not running as much does not mean you necessarily have to eat less, and adjusting that intake accordingly. So if you're focused around certain nutrition goals, like that's where a dietitian can step in and help. But you still need those nutrients, and trust me, like you don't want to deal with it when things hit the fan because you haven't been meeting them, and it hasn't been happening for a long time. It's such a pain. It's not that it can't be fixed, it can't be put back in order, but the better you're aware of it and the sooner you're aware of it, the better.
I think, do we have anything else that we wanted to, there was a question that came in about fitness across, like how young is too young for, and I know that you are a sports specialist, how young is too young for kids to engage in sports? Is there anything before we head a little bit off into that direction that you wanted to talk about?
Before that,
if Nick could insert music, it would have been that, but I unfortunately have to sing.
I don't think. Oh, maybe there's one thing. your training program and volume and program in which you've planned your runs will likely be a lot more important and weigh a lot heavier than the little tools you can buy to help recovery from the store. So I'm talking about massage guns, I'm talking about scrapers, I'm talking about the ice bath that maybe you want to put in your bag, whatever it is, or ice baths in general, sauna. Those all have their place potentially, but unless your training program, you can't like out recover a really horrible training program with tools. So making sure that you take the time to look at your training volume, how things are progressing, working with a professional to make sure it's not too much too fast, is going to do you a lot more than the massage gun that you can buy from literally anywhere now. And oftentimes, like those are fine for if you've had a productive workout and you're like, I'm going to have some soreness tomorrow. Like, sure, go for it if you can afford it, but know that like you can also live without it. But unless your training program is top notch, or at least you're paying attention to it with proper recovery, and I'm talking sleep and nutrition, those tools are not going to do anything. Same with supplements, same with all these other things that you can just add on. It's not what can you add, it's how can you modify and make sure what you have is really checking those boxes. And every paper that's going to come out, that's literally, it's just, oh, these are, it seems like this helps soreness, but also compared to sleep, not as well. These tools can be helpful for recovery, but also not much different than doing this. This is just consistently showing up like that. So just make sure you're sleeping well. There are some things that are like compression sleeves are great. They work really well, but the little tools, you can't out recover a poor program.
Yeah, but
Yeah.
like it's the wellness industry, right? So it's about how much
Correct.
more can we sell, how much more can we get you to buy, right? Like to fix yourself. Like it's easy to sell a supplement. You just take this pill or this green powder, and then you don't need to sleep. Like you can get 4 hours of sleep. But if you take a green powder, you'll get 8 hours of energy. So
Terrifying.
it's a win. And so like it's so easy to sell that stuff, and like people don't really want to read the research, right? Like who wants to read a
No.
research paper when this website tells me that my HRV
Oh
will
my
go up
God.
10% if I just take
No.
this pill, right? So why am I going to argue with a website? It's on the internet. So I think it's like fighting against
Mm-hmm.
the marketing
Is
machine
AG
that
none?
now has become, and not just them,
Sure.
but everyone, right?
Sure.
It's like, but we're fighting not only against like marketing, but now we've taken in social media influencers and said, here's $50, shill our product. And they're like, I've never gotten $50 before, like for my Instagram, but not like for my Instagram, for my social media. Like I'll take whatever, right? That's cool. What do? I just post this on my podcast that gets, 1 million downloads. Sure. Maybe it's more
Yeah.
than $50, but like, just still it's so easy to push
Yeah.
out this product now that like before it was like, okay, it's on TV, but we
Right.
ignore commercials, and like no one's going to read a magazine, so we skip it there. And now it's like in the thing everyone is viewing, right? And so wellness is like able to get into people's minds
Yeah.
so quick and convince you without these 10 supplements, these three, buying a sauna for your backyard and a
Yep.
cold plunge right next to it. With all this stuff,
Yep.
you're just never going to reach your goals.
In short. Yes. So anyway.
Mhm.
Who is your so kids in sport?
Mhm.
Do you work with a younger population?
Yes. I spent a couple years over at Stanford Children's Sports Medicine. So I worked with, I think my youngest patient was 8, and then my oldest was 21 within that sector. And I still get a lot of high schoolers and teens now. But yes, worked with plenty of kids. As far as like what they're doing, kids are playing sports pretty early these days. Um, above everything is get your kid playing and exploring movement, get them having fun outside. There's a lot that develops with balance, with coordination, with speed, with, for example, like the simple task of jumping. If you look at a 2-year-old do it versus a 6-year-old do it, that's very different. These things develop as you get older, and with that, those, when you're 6 or 8 years old and you start exploring different sports, or even just like t-ball or whatever it is, hitting something with a bat over a little, whatever it may be, all that is to facilitate an appreciation for activity and get them fun above all. That's important. But now we're seeing kids getting enrolled in these club teams and these seasons that are pretty intense. And there's summer season, there's fall season, there's spring season, there's summer camps, there's a training like across like a state away, or they're traveling the country, or there's a 2-week intensive and then they're doing private lessons, and there's all this going on. And early specialization is, it used to be that kids were playing different kinds of sports, which was really good, and we still recommend that. And early specialization has become more popular, I'd say, in the last, gosh, I don't know, maybe 15 years, 10, 15, a decade, maybe, whatever year it is. Just since we were kids, I would say after that, it became much more prevalent. And it's actually one of the biggest risk factors for injury. If your kid is specializing, if your 9-year-old wants to be a pitcher and all they're doing is throwing a ball, you are in for a lot of physical therapy visits, because that's not going to be great. So being able to coordinate other sports and getting them to explore movement is huge. Don't specialize early. There are some sports that they've found, like specializing early does improve skill level and does get them to the next thing, like gymnastics, is it ballet. These things are, yes, it's true that if you specialize early, but you also run the risk of the overuse and that overload to these bones, these tendons and stuff that are still growing and aren't quite adapted to that load that we just keep making them do and the frequency in which they do it. So that's sport. Which brings us to the component of how do we best prepare the kids so that they can play their favorite sport, or they can maybe specialize, or encourage them to move in different ways. And strength training is one of those things. And they're really, it's great. Like stunting your growth, right? No, total myth. Before, I remember when I was little, I was like, don't lift weights. You'll stay short, because I've always been short. And we know now.
Me too. I was like, whoops.
Oh no, it worked. But that's not a thing. And it's not dangerous to to growing. And the biggest thing at that point is if your kid is mature enough to follow instructions and be coached, then they are mature enough to be coached in the gym. And strength training is a great idea for kids and teens. I'd say like as young as 8, but you can I mean, if you think about bands, that's resistance training. If you say kids shouldn't resistance train at all, you're taking that yellow TheraBand out too. And like, is that really that dangerous? No, let's talk about it. So these little things can still help. It may be weight training, it may be bands, it may be body weight. They're squatting all the time when they're little. This stuff can continue. But being able to implement that with the right coach, with the right skill set, is huge for improving both their ability to participate in the sport, reduce injury risk, it improves their coordination, improves their performance. And one of the bigger things, if it's done right, it can actually really help facilitate a positive relationship with exercise at an early age, which we know now. We're still trying to get people to do this as they get older. You get a person that's in their 40s and 50s and hasn't necessarily exercised. I wish I did this when I was a kid, or I never did this when I was a kid. So we're going to the kids. So we need to work on this that way, because we all know that exercise is one of the best things to prevent disease in the lifespan. So the sooner you start, the better relationship you have at an earlier age, the better this will last you through life. So it's just setting the stage so that they can do that, and for a much bigger reason than just playing summer season or whatever.
Yeah, the specializing in sport for kids is something I've experienced with my daughters, which is crazy because when I grew up, I just remembered like I played sports whenever I wanted to, just hop from sport to sport. It'd be like once a week, there'd be a game, and that'd be it. It would like I remember spending a lot of time with my friends and doing stuff on the weekends, and so many sports are like, oh, we're gonna go 4 days a week and both days of the weekend, and it's like 16 to 20 hour week commitment. Oh, you're in school and you're 7 years old, and so I struggle with a lot of this. And like then it like the other part is like you're burning these kids out, and for what? So like we can win some titles for a 7-year-old that they'll never remember, and that the parents will. Like the parents are like, my 7-year-old won this, or I coach. Like that's great, but like these kids, are they going to be doing this thing in 10 years because you burnt them out? Like there's all that, and so like have them in sport. Like we make sure we encourage some sport every season just so they can get their energy out. But like some of these are so intense, and it's like I want my kids to enjoy this for their teenage years, maybe into college, post college, enjoy something, some sort of
And you get a
movement.
chance to set up those attitudes towards exercise and nutrition. Says they got to eat for practice. All of this is so huge to get right at an early age. Gosh, the more kids are, I mean, so many kids under fueling for sure. I mean, you go to practice after school. Which one of your teammates kind of skipped lunch just because they wanted to hang out? Like these little, they may not do it intentionally, but it's important and it needs to be recognized. And so getting a hold of like how to best facilitate these goals for these kids. And an early specialization is, that definition might vary. Some of them say pre-skeletally mature bodies, so pre-puberty if you're specializing. Some of them say even earlier than that, but generally around puberty or skeletal maturation is when we start to look at it. If you're doing all this specialization before, which makes sense. You're overloading bones that are not quite fully grown, that are susceptible to overload, and you get these growth-related issues.
So it sounds like your recommendation is to have kids of basically any age dabble in all kinds of sports and modalities. I love that.
Yeah. Have them explore something. I mean, you can find out what they like, have them try different things. I mean, you get two kinds of kids, one that doesn't really want to do anything, and then one that maybe wants to do one sport, or maybe the one that has three. I know there's challenges with this too. That's a separate subject. But if you can get them exposed to a kicking sport, a throwing sport, maybe basketball, soccer, whatever, just a mix of things, and encourage them. Maybe it's one or two, or maybe it's like a rec league on the side, or whatever it is. There's different ways. Not everything has to be super competitive, but they're doing things differently and they're moving in different ways. They're feeding their muscles and bones different movements, which is so much better than just the same thing over and over and over again. Because Little League ELO is not a fun one for those kids. Stress factors for ballet dancers, also not great. There's a lot out there that you just don't want to run your kid into.
All right. I guess we're coming to the close of this episode with Dr. Leada, but we have secret questions to ask Leada.
Ooh, super secret classified.
All right, open up the classified Google Doc, please. Thank you.
It's opened. No one can view it.
I'm ready.
All right. Are you ready? They're rapid fire, but they're also not. So
slow burn.
Take as much time as you want.
Put it on broil.
Yes. So, question the first. What's the best piece of advice you've ever received?
That's a good one. Geez, I'm never good at these. Best piece of advice I have ever received. It probably has to do with me being a female physical therapist in the sports world. It's really seeking to know your stuff if you're going to talk about it. Like, know your things well if you're going to be educating on that topic, especially in the sports. I mean, PT is primarily like a female-dominated field, but sports is not. And so being able to speak on issues well with the research and the evidence to back it and the experience is a big one.
I like that a lot.
Well, I don't really like it, but I do.
You know what I mean?
I don't like that she has to put on this extra.
Agreed.
Agreed.
You know, but
it's a real thing. It's annoying, but
you're smart, and it is annoying.
It's one of those things that you're like, ugh. But I'm
really
glad
annoying.
I was told.
I can relate. Yes, exactly. That is the best piece of advice. Yeah. Sorry for my female rage. Sorry.
I apologize.
Sorry, I interrupted.
I apologize for males everywhere. Just kidding. Anyway. What's the next question? Question the second. What's one thing that people are generally surprised to find out about you?
I think they're generally surprised to learn that I speak 3 languages, English being one, Farsi being another, and Spanish being a third. It's always a random fact. They're like, oh, weird. I knew it, but not.
That is cool. I speak half of the language. Half speak English well. Good. So
thanks.
That's a cool fact. I like it. Question to 3. What's something you wish more people understood about the physical therapy industry?
That we don't really like insurance either. And we know it's a pain, and you're going to see recently there's been a big shift, or you might start to see a shift in how clinics are run, being insurance based versus cash pay. And the reimbursement is truly not great. And so sometimes like insurance is great when it works, but also can be really limiting. So if you come across PT that's cash pay versus one that's insurance based, know that your insurance might dictate some of that care or the number of visits you can see that PT that they'll actually pay for. And they also may only reimburse the clinic a small amount, which makes the clinic have to see more patients so that they can stay open and pay their PTs. Whereas the cash pay, it might be more upfront, but then that's what it is upfront. And so it's like financially, you got to weigh your options. So just know that that's the main reason why these two models exist. And we don't love the way we have to bill insurance, or there's constantly a battle with what they're going to take away for reimbursements or what Medicare is doing. It's always changing. And so just know that we're in your corner. We're trying to advocate for you. We want you to get the best care. At least most PTs I know. So just know that part.
Yeah, I like my wife became a provider
Yeah.
on her own and started her own company, and like the one thing I learned was the side of the provider that like I wish more
Yeah.
people understood. Like, you know, it's fighting with insurance to even
Yeah.
get paid. It's like them turning down things, them not working with you, telling you to get your patient to call them. It's just like, so like I wish people would understand, like, yes, it's
Mhm.
not always about the money. Like, it's not like people are going cash because they want more money.
Right.
It's they want to provide better service, and insurance is literally
Mhm.
limiting what you can do in the session, or telling you have to do, it's our fourth session, so you have to do a check, and it's going to be the whole session where we go through these 12 things, and that's your whole visit. And you're like, well, I want to do something else, I wanted to grow. Nope, sorry, insurance
Right.
said it's visit whatever, right? That always happens, and like people are like, okay, I guess I'll be back next week and we'll
Yep.
do something new. So
Exactly.
yeah, anyway,
Yeah.
off our
Oh, you know
soapboxes.
what? I just thought
Back
of
to you, Amanda.
I think one of the best
We're
pieces
back.
of advice I got that revolves around not being a female.
Oh, you get more than one.
Okay, this one's a common one, but it was from my head athletic trainer in undergrad, and I was working in the training room as as I was getting my bachelor's of science. We were talking about taking care of all the athletes, and he kind of stopped us when me and my classmates were talking about what questions to ask an injured athlete, and it was very much like checklisty. And he paused us and he said, "Hey," and he gave us that quote: "People won't care how much you know until they know how much you care." And that really rung true with me, because like we've all been a patient in a doctor's office. It doesn't feel good when they're in a hurry. It's hard to convey, or maybe it's just hard to get, like, am I even a person in this room right now, or am I just a number? Or, where does that fall? And so that one was a big one for me. And so I think ever since then, that might have just impacted the way I go about talking to people and seeking to just structure my visits and ask questions.
These two human coaches love that. We do. That's our shtick. That's our spiel.
Love it.
So thank you for sharing that extra piece of wisdom. Y'all got a bonus. Answer. So before we head out, Dr. Leada, where can people find you on the World Wide Web and in real life?
You can find me in the Bay Area.
Don't give us your address. Don't do that.
No, Northern California, Bay Area. I work in the peninsula. You'll find me in clinic in San Mateo if you're local. And online, you can find me mostly on Instagram, but I am on Instagram, Threads, TikTok, Pinterest, Facebook, all at DrMalekPT, Dr. Malek PT. And my website's there too. Same thing, drmalekpt.com.
And where can people purchase your book?
Thank you.
Yeah.
They can get The Science of Stretch pretty much anywhere now. Amazon, bookshop.org, Barnes & Noble, Hudson, Books A Million, every major publisher. It's literally everywhere. And it's also available in German, in Italian. Spanish is coming out next spring or winter or something like that, or February. I believe Chinese is coming. I believe Japanese is coming. There's all kinds of languages coming, but But yes, English was
Oh
the
my
first.
goodness. Nick, we have
Love
a
it.
whole ass celebrity author on
No.
our
I
podcast.
know. I'll write a book in every
And-
language.
And soon, Leada will be able to speak all those languages.
I just learned how to say it in every
She's
language.
making her way. There you go. There you go. Well, Leada, thank you so much for joining us today.
Of course. Thanks for
Truly,
having
thank you
me.
for taking time. And thank you all, listeners, for joining us. And we hope you enjoyed this episode. I know we did. You can reach out to us at any time between twocoaches@gmail.com. You can reach out to Dr. Leada, and we'll make sure to include her information in the show notes. And we'll see you all next time.
Bye.